Okay, good evening to all the fellow Toastmaster and guests. My name is Pei Pei, and I'm your TOE session for tonight's health sharing session. So to begin with, right, we are very pleased to extend a warm welcome to our guests from Beacon Hospital, Miss Katrina Low and Dr. Anuradha tonight. So please join me to give them a round of applause for joining us tonight. Okay, so this evening we are very honored to have Dr. Anuradha with us to share her valuable insights on a topic that's very important to every woman, gynae cancer, and what every woman should know. Before we begin, let me just briefly introduce about her. Dr. Anuradha brings with her over 15 years of experience in the field, and she's a passionate advocate for women's health and cancer awareness. She specialized in gynecological-oncology surgery and has played a key role in promoting awareness of women's health issue in Malaysia. She holds a medical degree from Ames University and a specialized qualification from the Royal College of Obstetrics and Gynecology, UK. And currently, she serves as a resident doctor at Beacon Hospital. Outside her professional life, Dr. Anuradha is also very active in social media, where she continues to share knowledge and inspire others. In her personal time, she enjoys traveling and spending quality time with her loved one, something that she believes this will keep her balanced and grounded in both life and work. And with that, please join me in welcoming Dr. Anuradha to proceed with her sharing. Over to you, Doctor.
Thank you. Thank you very much for the introduction. So I can share the screen, yeah? Okay, good evening, everyone. So I'm a consultant gynecologist and a gynecology-oncology surgeon. So I did fellowship in Malaysia after my MRCOG. What gynecology-oncology means is I handle all the gynae cancers. So I do surgery for the gynae cancers. And I'm also licensed to give chemotherapy for gynae cancers. Okay, so let's start with what are the latest statistics in Malaysia currently. Okay, so this is the National Cancer Registry. Okay, as you can see, these are common female cancers. So breast cancer has always been number one. Okay, and number two common female cancer is colon cancer. Okay, but the number three, number four have been changed for the last few years. Okay, in a female gynae cancer, 10 years ago, number one was cervical cancer. Okay, number two was cervical cancer. Then, if you can see from 2012 to 2016, cervical cancer dropped to number three. And the recent data shows the cervical cancer dropped to number six. This is why, because there is a prevention method and cervical cancer is preventable, which you will know later why. And the uterine cancer has increased in the past few years. Okay, so now uterine cancer has increased, ovarian cancer has increased. The only good news is the cervical cancer reduced. Okay, so the most common female cancers are this. Now, before we go into female cancers, you have to know the organs, our reproductive organs. Okay, so we have uterus, the uterine body. This is the lining of the womb, the cavity, and the cervix. Cervix, even though it's connected to the uterus, we call it as a different organ as a gynae, the cervix. And then we have the ovary, and we have the fallopian tube, where you ovulate and your oocyte will go here, and your sperm meet here, and that's where fertilization occurs here, and then implantation of embryo occurs here. So the female cancer can arise from your uterus, from the uterine cavity, uterus body, from your cervix, from your ovary or tube. Now, as I said, the most common gynae cancer now is the uterine cancer or the endometrial cancer. Endometrial means the lining of the womb. Okay, So this is how an endometrial cancer will look like. Actually, I have a lot of real surgical specimens, but I always don't share to the public audience. It's always for the doctor's audience. If not, you'll all get scared, you know. So this is how if a cancer arises from the lining of the womb, and this is how a cancer arises from the muscle, the body of the uterus, womb. Now, what who has the risk for getting this uterine cancer or the lining of the womb cancer? Obesity is a risk factor. That's why I think why the uterine cancer is increasing now. Okay. What happens if when you are obese, when you have a high body fat percentage, the fat cell will turn into hormone. So you have excessive estrogen stimulation in your body. So excessive estrogen stimulation in your uterus increases the risk of you getting uterine cancer. And nulliparity means you never got pregnant. Because why? You always been getting your period. So when you get pregnant, you don't get period for the 9 months, So, and the estrogen hormone goes down. So it reduces your risk. And that's why if you never got pregnant before, it's one of the risk factors. Now, polycystic ovarian syndrome, it's a endocrine problem, it's a hormonal problem. It's very common nowadays, where a lot of young girls, starting young girls and stuff, are getting polycystic ovarian syndrome. It is due to hormonal imbalance, where it increases, causes insulin resistance, and you will put on weight as well, and you will have period irregularities because of PCOS. And diabetes is a known risk factor for endometrial cancer. HNPCC means this is a genetic condition. That means if your family has a high risk, you must know what are the cancers your blood-related families has. Okay, if they have endometrial cancer or uterine cancer, ovarian cancer, colon cancer, this can be genetic. Yeah. So a genetic condition called Lynch syndrome can also cause a risk factor for endometrial cancer. Of course, as you increase in age, you can get endometrial cancer. However, my youngest patient I've treated for this cancer is 21 years old, okay, and the oldest patient is 70 plus, okay. So I've seen both range of young and old and having all of this cancer. Now, what are the most common symptoms? Unfortunately, it can be something simple like just your heavy period. Your period is prolonged. Yeah, this can be as simple as this. So that's why many women present late to see the gynecologist because they think it is just a period problem, stress problem. That's why my period is very heavy. That's why my period is long, non-stop for 2 weeks, 3 weeks, maybe because I'm stressed. That's why I'm having this period change. But unfortunately, it can be a sign of cancer. And if once you have menopause, okay, menopause means 1 year you never got your period, that means you're already menopause. So after your menopause, you suddenly started having bleeding. It is also not normal. So it is also one of the signs of cancer. So many women present late because of this symptom. They take it very lightly. So I will always advise if you have any abnormal bleeding, please go and see a gynecologist. And if the cancer has advanced, then you can have pelvic pain, discharge, in between your period, have in between bleeding or irregular bleeding, and painful during sex, and of course, unexpected weight loss, and feeling of a mass in your tummy. And many women, when there's a mass in the tummy, they always think, oh, I thought I put on weight. So they don't really think there is something wrong going on. Now, what is the management of endometrial cancer? So, how can we diagnose this cancer? There is no screening method. Okay, there is no. Prevention is of course lifestyle. As you can see, the risk factor, one of the risk factors is obesity. Healthy lifestyle is is something that we have to advocate for prevention of any cancer. Okay, so there is no screening method for endometrial cancer, uterine cancer. So any patients who come with abnormal bleeding, the gynae will usually do an ultrasound and see is there any abnormality inside your womb. If the gynae sees some abnormality, we will do a biopsy. And then after the biopsy only we can confirm whether you're having a cancer or not. So once you confirm cancer from the biopsy, then the next will be imaging. It can be a CT scan, with plus minus MRI. And with the imaging, we'll do a staging. And the mainstay of treatment is surgery. Unfortunately, if the cancer is inside the uterus, you have to remove the uterus. Okay. So if it's cancer is arising from reproductive organ, you have to remove your female reproductive organ. So there's no other way around it. Okay. So, and depending after the surgery only will confirm what stage is this cancer. Okay. If it's in a very early stage, surgery is only treatment you require. Then after that, you just follow up. However, if it is stage 2 or stage 3, you will require a radiotherapy. Stage 3, you require radiotherapy and chemotherapy. Advanced stage 4, recurrent, may need added immunotherapy. Immunotherapy means it is the cancer cells attacks our immune cells. So we strengthen our immune cells to attack these cancer cells. That's what we call this immunotherapy. Now, ovarian cancer are most commonly known as the silent killer. Because why? Usually patients do not have symptoms at all, and 50% of the time when it's diagnosed is advanced already. Okay. Now, who are at increased risk of getting ovarian cancer? If you have family history of breast, ovarian, or colon cancer, you may have a hereditary gene to have this cancer. Or your own body can go through a genetic mutations. Okay. Any unhealthy lifestyle of your body DNA can go through mutations, and that can cause any cancer. And though, of course, postmenopausal is a risk and increased age is a risk. However, I have seen many young women. Even last week, I diagnosed a 35 years old lady. My youngest ovarian cancer patient is 13 years old. Okay, and she didn't make it. So as I see, I've seen a lot of younger patients are getting cancer. And I don't know, it could be because of environment, food, unhealthy lifestyle. Now, if it's in an early stage, very mild symptoms, maybe abdominal bloating, some pelvic pain, feeling full quickly when eating. Frequent urination is because there's a mass inside, maybe it's compressing on your bladder. That's why causing you to have frequent urination. But most of the women will think it's just maybe a UTI, urinary infection. So the pain is not specific. The symptom is not specific. If the cancer has been advanced, very advanced ovarian cancer, you may have changes in your bowel habit. That means suddenly you diarrhea, suddenly constipation, suddenly loose stool, suddenly diarrhea. Very alternate bowel habits. This can be a sign. Or you feel distended, your tummy is distended with a fluid inside. Actually, because the cancer cells is forming fluid. Or there is a huge ovarian tumor inside, also can have abdominal distension and back pain because of the pelvic mass. Of course, there is no way by an imaging or by an ultrasound we can know whether this is cancer or not. But usually an experienced gynecology can know by an ultrasound. This looks suspicious. So what is the next step? We will ask you all to take a blood test, cancer markers. But still, 50% of the time in early stage ovarian cancer, the cancer markers will be normal. So cancer markers are also not specific, but if it's high and high, then it confirms it shows towards cancer. And the imaging will help further whether this is cancer or not. However, cancer markers and imaging are not 100%. The only way we can know this is cancer or not by surgery. Okay, there's no way you can take a biopsy because ovarian tumor, just say it's like a balloon inside filled with the fluid and stones or something hard inside. So if you take a biopsy, it will puncture and it will spread. So usually there's no way we can take a biopsy from the ovarian mass per se. So usually surgery is the mainstay. So depending on the fertility age, whether if patient is very young, usually we'll just take out the ovary one side first and do a full staging surgery and see first what is the report says. So only after we taking out the specimen and send to lab, then only we can confirm this is cancer or not. There's no other way we can confirm it. Okay. And depending on the stage, if it is earlier stage 1A, 1B, then surgery alone is the treatment. If it's 1C and more, chemotherapy is the treatment. Yeah. So stage 3, stage 4 ovarian cancer, we will add targeted therapy, we will add immunotherapy. Now, cervical cancer. So this is the cervix. So the cervix is only can be visualized from your vagina. Okay. Now, the risk factor for cervical cancer is number 1 is human papilloma virus, known as HPV. So anybody who have sex can get this HPV infection. Any woman, okay, any couple, 90% of the time you will have this and you will not have any symptoms because it's a common infection. But if you have unhealthy lifestyle, very weak immune system, then this virus will sit for so many years in the cervix. Then it causes abnormal cells, then pre-cancer cells, and then eventually cancer. So it takes time for it to become cancer. So how we can prevent this is number 1 by HPV vaccination. So it's good that Malaysia is one of the first in the Asia country to start national immunization HPV for 13 years old schoolgirls. We are one of the first from 2010. So I truly believe because of the awareness of HPV vaccination and been giving vaccine since 2010, the cervical cancer have reduced tremendously. So that means the vaccination helps. So HPV vaccination is the primary prevention. Number 2, even if you had vaccine, you still have to do a pap smear. Yeah. So pap smear is for those who already sexually active. Yeah. Not for us single virgin ladies. So once you have sex, after 21 years old, you must do a pap smear screening every 3 years. Once you are 25 and above or 30 years old, you can add HPV test or do HPV test alone. So HPV test is to detect the culprit that causes this cancer. Okay. If your HPV is negative, you just have to do every 5 years. So the cervical screening is once you had sex from the age of 21 years old up to age 65 years old. Okay. So many women, once they lost their husband or they are divorced or something, they say, I'm not sexually active. But you have been sexually active before. So even if you had sex one time, you have to do cervical screening. Yeah. Up to age of 65. Now, what are the symptoms of cervical cancer? So as I said, it takes many years to develop the cancer. So very early cancer, early stage of cancer, there's no symptoms at all. Okay, once you have symptoms, that means it's already advanced cancer. Okay, so what are the symptoms? Bleeding between your periods or after menopause, bleeding that is longer than usual, bleeding after intercourse, pain during intercourse, pelvic pain during urination, need to urinate more often. That means there's a mass compressing. Any abnormal vaginal discharge, any abnormal smelly discharge, or weight loss. Weight loss means it's already very advanced cancer. The management, when patient comes with, if the patient comes, when they do an pap smear and the pap smear shows abnormal cells, we can, if we do a biopsy, it comes as pre-cancer, we can treat it before it becomes cancer. But if the woman never do cervical screening, okay, and develop into a cancer, a growth in the cervix, then we have to do biopsy. Once the biopsy confirms it's cancer, of course, next is imaging. And cervical cancer is a bit different. Surgery is not the main treatment, but if surgery can be done, means it's your curative. That means it's only surgery can be only done for stage 1 and very early stage 2. Only we can do surgery. So late stage 2 and above, we don't touch the patient. We straight away do radiotherapy and some chemotherapy. And very advanced cervical cancer is immunotherapy. So it is sad, cervical cancer should not be happening because it is preventable. Now, vulva cancer, I've been seeing quite a few for the last few years, as young as 25 years old, 35 years old, 45 years old. So if there's any lumps or bumps, please don't ignore this. Any non-healing lumps or bumps in your private part or the external genitalia of female. Okay, what could be the symptom? Persistent itching, bleeding or unusual discharge, soreness, burning sensation, a lump or mass. A lump or mass that is not healing. Don't just go keep buying medicine from the pharmacy, applying yourself. But I've also seen GP has been treating it and never referred for a biopsy. So that is quite sad. So anything unusual symptoms, please, if you're not happy with the first doctor, you go ahead and have a second opinion. Okay. So the risk factor is the lichen sclerosis, one of the skin condition where the private part is all thinned out and very white, and it's more common for postmenopausal lady. And of course, increasing age is a risk. And if you have a HPV or HIV infection, you have a risk factor to get this. Of course, family history of melanoma or skin cancer. So how to prevent all this? Quit smoking, get HPV vaccine, and the regular screening. This is regular screening. The regular screening is not talking about is only for the screening of the cervix. There is no regular screening for the vulva. But of course, when you see your gynae frequently, of course, they're going to examine you as a whole. But at home, when you see yourself, make sure you know your body, make sure you know your skin, because any unusual things, you, the one, have to suspect something and go and seek medical attention. So the management, of course, we take a biopsy, surgery. If it's a small lump, we just remove the lump and we stitch it. But if it's a very major, it involves the plastic surgeon as well, because we're going to remove a very huge part of tissue, and then we have to do a flap, and it can be very, very, very painful. So if there's any small lump or bump, please go and seek a gynecologist. And of course, the other thing is radiotherapy. If it's advanced or mid stage of this cancer. Yeah. Thank you. So, is there any questions?
Yeah, thank you, doctor. I think there are a few questions from the floor. Maybe I can read out for you. Okay, number one is
Okay.
how to know or differentiate the normal bleeding and abnormal bleeding.
Okay, so you must know your menses first. You must understand your menstrual. So if it's good, if you can have a menstrual app, that will be the best to record your bleeding days. So usually if you have regular menses, you have regular days of flow. So if it's always been 3 to 5 days, so it's always 3 to 5 days. Suddenly now it happened 7 days, 10 days, 14 days, the bleeding is not stopping. You're continuously having bleeding and you have a lot of blood clots. Before this, you only need to use 2 or 3 pads per day. Now you have to change the pads every 2 hours. So that is not normal. Yeah. So when you anything out of your ordinary, then you have to go and seek medical attention.
Sure. Okay. The second question, is it a cause for concern if there is bleeding in between two period cycles once in a blue moon?
Okay. Okay. If every 2-3 months once, 2-3 months once, it still is not normal. Once in a blue, once a year means that is fine. But it's still, if you are sexually active, the first thing I will do is make sure you have done a pap smear. Yeah. So sometimes it can be just a vaginal infection, or it can be because of some cervix problem, or it could be some polyp sitting in the cervix there, you know. So you will not know unless you go and have a check.
Sure. Okay.
Sorry,
Thank
hold
you.
on. Yep.
Okay. Okay, we'll come to the third question. Does it mean if no sex in lifetime, then there's no need to take smear?
Yes. So if the only way the HPV can get is at least if you have skin to skin contact with the external genitalia, the HPV can be there over the skin, but otherwise you will not get HPV infection, so you don't need to do cervical smear. If you're virgin, you never had penetration at all, there's no need to do a pap smear.
Okay. Okay. We'll move on to the next question. Does a hysterectomy eliminate persistent HPV?
If your hysterectomy is total hysterectomy, there's a subtotal and total. Subtotal meaning they're left behind the cervix. Okay, if a total hysterectomy means removed with the cervix. So if you had a total hysterectomy and the report comes back, the cervix is normal, you don't need cervical screening anymore.
Okay, sure. Okay, we'll move to the next question again. I got my HPV when I was 17. Should I get another jab now? How frequent we should get the vaccine to ensure vaccine protection?
You only need once in your lifetime. Okay. So according to the company, if it's less than 14 years old, one dose is enough. But more than 14 years old is according to the company, the drug company, which is 2 or 3 doses. Usually they advise 3 doses. Okay, if you've completed the 3 doses, you don't need to repeat anymore. However, now the WHO says even one dose is enough, at least, at least. But if you have never taken vaccine and you have the opportunity to take, I will advise take the 3 doses. So you can take HPV vaccination from the age of 9 up to age of 45. And please advise your male partner to take the vaccine as well. Okay. The HPV vaccination should be for boys and girls. However, like in UK, Australia, US, they give for both the school girls and boys. However, our budget are tight. We only give for girls. And there's no way we can test HPV for male. There's no test available until now. There's only test available for female. So I will always advise if you can ask your male partner to take the HPV vaccination as well.
Okay, thank you, doctor. We'll move on. I am 65 and not sexually active. Will I still get cancer?
You're 65.
And not sexually active. Will I still get cancer?
You may not get cervical cancer, but you may get uterine cancer and ovarian cancer. You know how many times I've diagnosed cancer from a health screening? Patient just came, go to health screening, just incidentally found the cancer marker is high. They did an ultrasound, noted a mass, and they referred to me, and I've diagnosed the ovarian cancer. I've already seen few, so I will always advise once you're more than 19, 20 years old, do in an early young age, you have no family history of cancer, do at least 2 yearly screening. After 30 years old, make sure you do yearly screening. And after 40 years old, all female must do mammogram, So you must do a screening, to know that. Because now we are also living longer, okay? And my oldest cancer patient, ovarian cancer patient, is 90 years old. 90, okay? She went through a major surgery, she completed chemotherapy, and she walked out well. So we are living in a population where we're living longer now. That means till the end, you have the risk of getting cancer. So healthy lifestyle plays a role, and make sure do screening.
Sure. Okay, thank you. Okay, we'll move on again. How long does the protection from the HPV vaccine last?
As I said, lifelong. Okay. There's no point if you're unhealthy and you keep jabbing vaccination. Okay. The vaccine is to boost your immune system. Okay. If you have very bad healthy lifestyle, I mean, you don't have a healthy lifestyle, very bad lifestyle, you smoke, you alcohol, you don't exercise at all, you take all the sugary processed food, whatever vaccine amount you take also is not going to help you. Okay. So this vaccination is only to boost your immune system, and once is enough, okay, for lifetime. But I always emphasize lifestyle is important. It starts from young. We have to teach our kids young as well. I think because of the diet and the lifestyle and the environment from young itself, it's causing a lot of medical problems nowadays.
Okay, thank you. Okay, next. If menstrual volume is getting lesser and lesser, finish within 2 days, is this a symptom to any cancer?
No, lesser is normal. Most probably as you get older, when you're 30s, then going into 40s or late 40s, your period may get lesser and lesser. Okay. Or some even just have 2 to 3 days of period. That is absolutely normal. Okay. But as you go into perimenopause phase or going to menopause soon, usually your period will become lesser and maybe you'll skip few months and it'll stop. Yeah. Lesser it's fine.
Okay.
But you
Next,
don't get period at all, that is abnormal. Sorry.
that is abnormal.
Yeah,
Okay.
so, you're in a reproductive age and you don't get period for 3 months, 4 months, that is not normal. Maybe you have some PCOS or what.
Mm, okay, sure. Okay, thank you, doctor. Next question. Is it means no baby delivery have higher chance on getting cancer?
It is just one of the known risk factor. Okay, because why? When you get pregnant, you're resting the 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 ovary, you're resting the hormone, your estrogen hormone goes down, so you have lesser exposure to this, lesser wear and tear to the ovaries, things like that only. It is it is one of the risk factor. But if you ask me, in my experience, okay, it doesn't matter. Okay, I have seen with those who have kids and also with those who don't have kids.
Okay, yeah, okay, sure. Okay. Next, any side effects to the vaccine for us ladies?
No, it's just the immediate effect for any vaccination. You may have soreness, you feeling fever. That's it. There's no long-term effect.
Okay, okay, okay. Next, is the HPV cancer caused by skin to skin contact genitalia only?
And what I'm saying is, even your male and female genitalia, that means, just skin to skin contact only without a penile penetration, you still can get HPV. But the HPV will be at the external genitalia only. So in the external genitalia, you can get vulva cancer, you know? Yeah. So for that, we don't have screening method. Okay. So if there's any lumps or bumps in external genitalia, you get checked. Okay. Only if you have a penile penetration inside your vagina, then only you start doing the HPV screening or cervical screening. Okay.
Okay. We'll move to next. Is pap smear very invasive? Is there an alternative?
Okay. So HPV is we're taking the pap smear from the cervix. So in order to do a pap smear, the doctor will insert a speculum inside your vagina. It is not invasive. Invasive, we usually call it if you need to cut. That is what we call invasive procedure. Okay, this is just an examination. There's a vaginal examination where we'll put in an instrument inside the vagina. We'll open up, visualize your cervix, and we'll take the pap smear. Okay. Now, the alternative now, what we have in clinic kesehatan is a self-swab HPV test. Okay, I mean, you go to clinic kesehatan. I mean, the problem usually is only married women can go to clinic kesehatan. Okay, so the self-swab HPV, they will teach you how to do. So you yourself will insert the swab inside your vagina. There's a marking how much length you can go inside. You do yourself and take it out. Okay, so this is available in the all the clinic kesehatan only, not in any hospitals. Yeah, so this is because why? Because a lot of ladies don't come because one of it is they're shy. They don't want to see a doctor or a male doctor, to get their vagina checked. Many female are shy, especially the low socio-economic population. So that's why the government is now promoting this so that more women will come up and do the screening. So this is a method to cover the screening as much as we can for the Malaysia population.
Mm, okay. Okay. Thank you, doctor. We'll move to next. For male, also take 3 doses of HPV vaccine.
Yes, more than 14 years old, yes, 3 doses, up to age 45 only.
Okay. Okay. Next. Hi, doctor. Can PCOS cause prolonged menstruation?
Actually, PCOS can cause irregular period can cause heavy periods. So basically, PCOS most commonly is it will start with irregular period where don't get period for 2, 3 months, 4 months, 6 months, and then suddenly you will have heavy bleeding. So yeah, it can be a symptom of PCOS.
Okay. Okay. Next, doctor, can you share your opinion on how cortisol, stress hormone imbalance, can impact estrogen level and cause insulin resistance, which can become contributing factors of gynae cancer?
Okay, it's not only gynae cancer. Okay, um, you see, it's also breast cancer and things like that. Okay, so you see, every month our estrogen progesterone grows through a lot of fluctuation every month in a menstrual cycle. Okay, so the graph can go haywire if your lifestyle is not healthy, your stress hormone is high. Okay, so your stress hormone is high, you don't sleep well. Okay, actually, female need more sleep than men. Okay, we need 7 to 8 hours of sleep, and we must have consistent sleep at the same timing every day, including weekend. Why? Certain hormones are high, certain hormones are low at certain times. Okay, that's why we suggest this follow your circadian rhythm for your sleep cycle. Okay, so if you don't follow this good sleep cycle, or your stress hormone is very high, this our menstrual cycle is very sensitive. Okay, our female hormone stimulation starts from the brain. The brain releases the hormone, stimulate the ovary, for the ovary to release the hormone, and it goes back to the brain again. It's a cycle. It's a very complicated cycle. Okay, so any interruption to your body, like a stress hormone, not enough sleep, and all that can affect the hormone, can cause sharp or hyper fluctuation or sharp fluctuations of this estrogen, and can cause hormonal problem and irregular period and all that. Okay, so stress hormone will not directly cause you cancer, but of course it can be a part that can cause excessive estrogen stimulation. So excessive estrogen stimulation in the breast or in the uterus over the time for so many years, it can trigger cancer. Okay, insulin resistance alone is also not only stress hormone, is also insulin resistance can be just triggered because of your unhealthy lifestyle, obesity, stress, everything. Anything can cause all these unhealthy things can cause insulin resistance. Yeah.
Thank you. Okay. Thank you, doctor. We have the next question. Is it normal for to feel a bit of pain or discomfort in the private part on the first day of menstrual?
Cramps are normal. Okay, so you must remember, even if you have period cramps, you must be able to do your normal job or chores. Okay. If you are curling in the bed, you cannot get up like that, that is not normal. Okay. So if it's mild cramps are normal, but if you're suffering in pain, you cannot go to work, you need to take MC, you need to take a lot of painkillers, you have to curl in the bed, and that is not normal. Okay? So you may need to see your gynae because you may have condition called endometriosis or something.
Okay. Thank you, doctor. Okay, I think that will be all from the floor. Just yeah, last shout out to the floor. Any questions before we end this session? If there's any question. Okay. Mm, okay. Okay, I think that will be all. So a very big thank you again to Dr. Anuradha for your amazing and insightful sharing tonight. We really appreciate you taking the time with us to explain everything so clear and passionately. It was such a valuable session, and we definitely learned a lot from tonight's session. So if anyone would like to follow up or needs any further advice, just feel free to make an appointment and visit Dr. Anuradha at Beacon Hospital. And thanks again, Dr. Anuradha, for being so generous with your time and knowledge tonight.
Thank you.
Thank you.
Thank you very much, everyone. I think one of my patients, Ida, is here. Hi, Ida. Okay, thank you very much. Thanks for the
Hi,
opportunity given.
Doctor. Just would like to thank you from the bottom of my heart for pushing me to make that decision. I was so much better, and I think like without you encouraging me to just do it, I don't think I would survive. Thanks, Doctor.
I'm glad I could help. Thanks, Ida. Thank you. Thank you, everyone. Good night. Bye.
Thank you.
Good night, doctor.
Bye.
Thank you.
Thank you so much.
Thank
Thank you.
you.
Thank you.